Welcome back to Living Local DMV. Our back to school coverage begins, and our next talk, we're talking with health tips that should be top of the mind for parents as our kids return, not just to class, but everything that encompasses a new school year. Miriam Fischer, a physician with MedStar Health, joins me here on the couch to talk everything from nutrition to athletic safety. Thanks for joining us today.
Absolutely.
Well, let's jump right in. What is a medication action plan as kids head back to school?
The medication action plan is you put it together with your pediatrician and you give it to the school, and that way the school knows exactly how to take care of your child. It keeps your kid safe, and it gives you that peace of mind that if something happens, they know what to do.
Yeah. And now, do you give that directly to the school nurse? Are you sending that with your child?
It comes with the school forms. Pediatricians absolutely know how to fill it out.
Okay.
All doctors know how to fill it out. We can take care of it, and you send it back.
Okay, good to know.
And they'll take care of your child.
Good to know. Moving right along to sleep nutrition. I think this is an important conversation, or sleep hygiene, as I like to call it. Why is that so important for getting back on track?
Huge.
Yeah.
We feel it too, but kids, they're not going to learn as well. They're not going to be in as good of a mood, and they're just not going to feel good if they're not sleeping well. So today, if they were tired, you did not miss the boat. You can start tonight. Get them in bed early, get them relaxed, no big sugars, no sounds or lights before bed, and kids need a lot of sleep. So preteen, or the little ones, the preschoolers, they need 10 to 13 hours of sleep a night. School-age kids need 10 to 12, and those teenagers who want to stay up late, they still need to sleep. They need 8 to 10 hours a night, and you'll see, if you start getting that habit with them, you'll feel better too, and you'll be more patient, and you'll be better at your job.
I need to be on the toddler schedule. I need the 10 to 13 hours of sleep. How does nutrition and even hydration factor in?
So we all know when we're hungry, we can't learn.
Yeah.
And we can't be kind to our classmates. The biggest thing is you start in the morning with a good breakfast. Yes. We really want to avoid not just sugary drinks, but those sugary foods. They taste good, and then the kids crash, and they're not getting nutrients. One thing, a pro tip that I have from my house is we talk about it together. We have the kids engaged in packing their lunches. The best is if you do it the night before, so you have it ready to go and their breakfast is ready to go, and it really teaches them responsibility, caring for their body, and sets them up for success.
And let's pivot over to the conversation around mental health. So as things are transitioning, I think, as parents, we could probably anticipate some of the sleepiness, some of the frustration, some of the anxiety. But when it comes to mental health, what are some things that we should really be looking for?
New beginnings are exciting, but kids are like us. They're anxiety provoking. They can be nerve wracking. And so kids can have sort of a range of symptoms. Some of them physical, so they're not sleeping well. They have headaches, they're vomiting. Some of them sort of more emotional. They're trying to avoid school. They're more clingy. They're even a little bit more agitated. Validate it. It's normal. I feel it too when I tell my kids, this is normal. I get this way. Yeah. But there's a point where it becomes not okay, and that's where you as a caregiver and a parent should get on it. So if it's really disruptive, if it seems to be lasting too long, if something doesn't seem right, stop by that pediatrician as your first stop and get on top of it so we can set them up for success. We still have a long school year, and so now's the time to put these things in place.
Absolutely. And most importantly, how can we stay in touch with you and MedStar if we need any of services that are provided?
We are always here to take care of you. MedStarHealth.org. You can stop by any of our places. We are happy to take care of all of the region.
Wonderful. Well, Dr. Fischer, thank you so much for joining us today. Appreciate you. Happy back to school.
Happy back to school to everybody.